Alrighty, so this is the final lecture of Chapter 1, where we cover some of the foundational principles of applying to medical school. And this one is the emphasis that your PharmD is gold, but it certainly doesn't guarantee that you will get an acceptance. So, despite how unique the educational background is that we have, the clinical skills that we utilize, and the, role that we serve on the healthcare team, with all the training and that combined, it can lead to a pretty interesting pharmacy, application for a reviewer to look through. So it definitely has its merits, but I also want you to know that it doesn't guarantee acceptance. We still have to play ball with the rest of the application cycle, meaning that your GPA still needs to be substantially high. You still need to have good MCAT. You still need to have good shadowing hours. So despite the PharmD being gold, I think that you also need to make sure you don't walk around with a chip on your shoulder thinking that it's a guaranteed, it's a lock. I'm super interesting, and so everyone else is going to think that as well because of my background. So I think that's important to keep in mind, but it's also important to acknowledge that the hardships that the PharmD obtaining the PharmD you've come across. And so I think some of those important features are especially professionalism. Graduate school fosters a lot of professional development, a lot of maturity in its students, and so those are major advantages that I think you can carry forward when it comes to applying to medical school. And this will become particularly important during the interview stage. It's very apparent when you're interviewing with other peers. There's also a lot of life experience that comes with your PharmD, and that which just includes exposure to the healthcare system, working on a collaborative team, having that interprofessional development, and so on. So having those experiences allows you to feel a lot more comfortable in a healthcare setting where you're able to work under pressure or to be asked particular questions that are associated with patient care. So as someone who's actually involved in the care versus maybe a traditional biology major who is a pre-med who basically their only exposure is shadowing, you have a lot more of a stake in the process. So I think that also is very helpful. The last component is obviously the medical knowledge. Of course, you're trained to be a pharmacist and to make clinical decisions. That's something that is useful to articulate on the primary application and so on and in interviews, but you're not exactly getting questions about different medications and what's this pharmaceutical principle. So that's something that's you kind of have to extrapolate out a little bit more. That'll be more useful once you're actually in medical school itself. And then the final note I want to address is the common question of why medicine and not pharmacy. So this is the most important question you're going to come across, and I introduce it now into the lecture series because it's something that you really need to think about and have a profound answer to. You're making a dramatic career change here, and I think a lot of people who are interviewing you and basically assessing your qualities for getting into medical school can appreciate that the PharmD is important, but they need to understand why you're actually doing this. Why would you leave a perfectly good career, a perfectly good profession, and a high-paying one at that, to then pursue medicine? Is this some kind of power trip, or do you actually care about, helping patients and expanding your role? So I want to just introduce that concept now because it is something you need to be thinking about, and it will come up endlessly. Your peers will ask you in pharmacy school, your professors will ask you, everyone who will ask you about this, family, friends, and everyone at the interviews will ask you. So I think it's just very, very important to keep that in the back of your head and have a shotgun and go answer, because it will come and you'll be sitting there I never really articulated why I want to do this. I'm just kind of doing it. So make sure that you do have a profound answer to answer that. All right, and with that, this concludes the first chapter of the course. Thank you for watching.